Good evening and welcome. I'm Linda Freed. I have the honor of serving as the Dean at Columbia University's Mailman School of Public Health and welcoming you to what feels very much like a global family dinner. Thank you for joining us this evening to commemorate 15 years of ICAP's profoundly important and world-changing accomplishments. I'm thrilled to look across this family dinner and see so many of ICAP's longtime supporters, faculty, as well as leadership from across our school and the university, including university trustees, medical center, board of advisors members, and Mailman School overseers, including Mrs. Phyllis Mailman, and of course, the amazing ICAP team. And of course, we cannot commemorate ICAP's 15 years without also honoring the extraordinary leadership of Dr. Wafaa El-Sadr.
I still remember when we were in Ethiopia, we were in a van on some dirt road. We'd been driving for about 2 hours when I looked up and said, what don't you see? And the answer is we no longer saw power lines. We were beyond the electrical grid. Yet we went to an ICAP clinic powered by a generator to which people walked 2, 3, 4, 6 hours to get HIV testing and care. And it was clinics like that, it's still clinics like that, that are responsible for the remarkable decline in mother-to-child transmission of HIV and the ability to suppress the viral load of a patient sufficiently that not only does that patient not have symptoms, but they also will not transmit the infection to someone else. I think of this as the best international effort of the United States since the Marshall Plan. This really changes people's lives.
From our vantage point, tonight, 15 years after the founding of ICAP, it is easy to forget the very different state of the world at that time and the challenges that the fledgling organization confronted. Viable treatment options for HIV/AIDS were finally becoming available, yet the ability to deliver promising new forms of care to people in need was very, very limited. These obstacles were particularly daunting for underserved populations in Africa and elsewhere that Dr. El-Sadr wanted to reach. Along with her dedicated colleagues, she set out to create a new patient-centered model that would overcome these challenges, succeeding where other approaches had failed. Amidst the fear and chaos that characterized treatment and prevention efforts at the start of the new century, Wafaa adopted as her goal that those who were suffering from HIV/AIDS in poor countries should have the same access to medical advances available to patients in wealthy nations. Wafaa and ICAP are responsible, in my view, for two revolutions. One in the treatment of HIV/AIDS, and the other in changing our sights as to what can be accomplished through the university's intelligent and energetic engagement with the world around us. ICAP proves the value not only of interdisciplinary collaboration, but of being part of the world that needs universities. We are grateful to all of you who have dedicated your lives to ICAP. And your legacy lies in the communities that have been transformed and the lives that have been saved. What a legacy. It is an honor to celebrate with you this evening and to introduce the founder and leader of ICAP, Dr. Wafaa El-Sadr. Wafaa.
And thanks to all of you for being here with us tonight, colleagues, friends, supporters. It's wonderful to celebrate 15 years of work but also it's wonderful to have you here to look ahead to the next 15 years. I am truly honored to work with tireless fighters. These are the people of ICAP, who never give up, who endlessly strive for better ways to solve problems, to be more creative, and to look for those answers that will change and solve major problems.
You've heard a lot of people talk about Wafaa's international work, but as she said, I met her more than 30 years ago when mothers wouldn't touch their sons who were dying in Harlem Hospital, and babies were being left by the hundreds from mothers who were addicted, and babies were withdrawing and dying themselves from AIDS. And in walks Wafaa, who takes over and makes everything right. I saw her and watched her work at Harlem Hospital with amazement, respect. Thank you so much.
We seem to be at an inflection point in terms of global health. There have been so many remarkable developments, as you've heard, over the last 2 decades, especially in response to the HIV/AIDS crisis, especially in terms of the prevention of the death of mothers and children around the world. It's also clear, I think, from everything that we've heard, that the achievements of ICAP and the achievements of Wafaa El-Sadr, and I think that we would not be here without Wafaa, are truly remarkable.
When you want to do big things that have global impact, you really have to do it on the basis of solid scientific evidence. And that's, I think, the beauty of the marriage between the fundamental, basic, and clinical science, which led to our being able, Wafaa, Deb, and others, to be able to really articulate with a strong conviction that we actually have the tools to do the things that are seeing right now, transforming the lives of HIV-infected individuals.
When you say, what is that secret sauce? You had people of compassion and passion for others and a strong scientific mind that was willing to try to do new things, but collect data all along to figure out how to do it better, and built teams that were confident in their ability, and you can see that in the country directors you see today.
Through our partnership with ICAP, we've learned how to use evidence. We've developed in research, we've conducted the 2 incidence measurement surveys, we have had that capacity in the country, and we are growing in that. So we want to recognize that they've made us and they're making us ethical policymakers.
And I felt from my Harlem years that HIV can create a transformation in the whole system because it is a chronic disease. Somebody who has HIV, there's no cure for HIV thus far, but that it requires a whole transformation. It requires the nurses and the doctors to realize that they have to develop a relationship with a human being for the long term. It requires that the laboratory be there to do the tests that are needed. It requires that the pharmacy have the drugs all the time, never run out. It requires that the data be there to know what people are doing. It requires that the staff are trained and work together as teams. For the first time, you had nurses sitting with doctors, with community health workers, all around trying to do one thing, and it is to preserve the lives of the people in their communities. And I think it was that sense, I believe, that HIV offered us the opportunity as a global community to have that impact. And that impact, I think that transformation will make the health systems be able to tackle whatever comes their way.
And there was ICAP and a few other universities who stood up and said, we'll help. We'll help. We have our research, but we're committed to the communities. And people like Wafaa put their research a little bit on the back burner, and Dr. Fauci was sympathetic to that, and helped stand up programs for where there was nothing, overnight there was something. Where there was despair, now there was hope.
Theoretically, if you could access every person in the world who's HIV infected and put them on antiretroviral therapy, to bring down their viral load to below detectable level, you could stop the HIV epidemic tomorrow if you could do that. So knowing that scientific basis gives us all of the ammunition in the world to say it would be crazy not to fund PEPFAR. It would be crazy not to fund Wafaa and her team.
So we've been with ICAP, first coming as a treatment and support, a partner, but now I can say it's plus, plus, plus. I can't count all the support that ICAP is bringing into the country, but that's where our treatment and care programs took a leap. We saw decentralization of the art treatment. We saw the use of nurses to initiate art, all facilitating that treatment goes to the periphery where people are. And ICAP held our hand through and through that process because of the presence in country. And I must say, we really appreciate that support that ICAP brought and tapping on all the resource network and expertise that the ICAP family globally has, and we benefit in the country.
I think ultimately what has made the HIV response successful has been the partnership with the affected communities everywhere, whether it be in this country or Eswatini or anywhere around the world. And we need to keep that in mind if we're going to tackle diabetes or hypertension or whatever it might be. We need to engage the communities. This is another important lesson learned.
So the issue is, when you have solid science backing you, you're on very, very firm grounds. And that's what I call the interface between the pure scientific evidence and the implementation of the things that result from the science.
This kind of forethought that Columbia had to set up these institutions, so critical, because at the time, you think you're serving one thing, and in the end, you have this global reach that changes the future of whole countries.
So the investment in people, investment in systems, and whether they be laboratory systems or data systems or technologies or any other system is very fundamental, because I think ultimately it will benefit all of these and enable the countries to tackle all of these health threats.
I want to ask two young people to come up, Mercy and Austin.
ICAP has been part of our life every step of the way, helping us to stay healthy, helping us to cope, supporting us throughout the years.
There are many more young people like us who can gain from this kind of work in Kenya and beyond.
Living with HIV has made us realize that life does not give us guarantees or warranties. It only gives us opportunities. And it's upon us to take the opportunities and make the opportunities success. Thank you, ICAP, for standing with us and helping us realize our dream. Thank you.
Thank you.